Hello friends, welcome to Expert Medical Coding. In this video, we are going to learn about the condition called esophageal varices with bleeding. We are going to see the symptoms of this condition, causes, tests, and treatment options available for this condition. So, let's get started. What is esophageal varices with bleeding? Esophageal varices are the enlarged or the swollen veins on the lining of the esophagus. The symptoms of it are vomiting large amount of blood, black tarry bloody stools, lightheadedness, loss of consciousness in several cases. Now let us discuss about the causes of this condition. The first cause is the liver diseases such as the cirrhosis. The liver is the organ that cleanses the toxins from the blood. The portal vein delivers blood to the liver. Esophageal varices usually occur in people who have liver disease. Blood flow through the liver slows in people who have liver disease such as cirrhosis. When this happens, the pressure in the portal vein goes up. High blood pressure in the portal vein pushes blood into surrounding blood vessels, including esophageal vessels. The extra blood causes esophageal veins to expand, swell, and bleed. This condition is called esophageal varices with bleeding. Now the second cause is thrombosis, that is, blood clot formation in the portal vein. Thrombosis blood clot in the portal vein causes esophageal varices. The extra blood causes esophageal veins to expand, swell, and bleed, results in esophageal varices with bleeding. Now let us see the tests. The tests are upper endoscopy, capsule endoscopy, and CT and MRI scans. Now let us discuss about the treatment options of it. So there are both non-invasive and invasive treatment options available. Non-invasive options are medications such as octreotide, sandostatin, and vasopressin. Vasostrict slows the flow of the blood to the portal vein. Now let us see the invasive options available. They are ligation of the esophageal varices, TIPS procedure, and liver transplant procedure. Please like, share, and subscribe to Expert Medical Coding. Thanks for watching.